As I said earlier, all of these metrics have dropped dramatically since the beginning of the new year, down by about 80% overall. On vaccines, in total, over 2.9 million people in Massachusetts are now fully vaccinated. We will go over 3 million people in Massachusetts fully vaccinated before the end of the week. In total, over 4 million people are either fully or partially vaccinated, and we expect that we will hit 4 million people fully vaccinated by the beginning of June, which was the projection we made several weeks ago. For several weeks now, we've continued to be a top performer in the country when it comes to administering both first and second doses per capita. We're number one in both of these categories among states with more than 5 million people, and we're number two in both of these categories among all states. 73% of adults in Massachusetts have had at least one dose, making us one of only 3 states in the country to cross the 70% milestone. We've also administered vaccines to over 60% of our total population. Almost 90% of our residents over the age of 75 have received at least one dose, a metric where we are far above the national average. And as the father of the son of a 93-year-old, I particularly appreciate that metric. And in Massachusetts, virtually everyone who gets a first dose is returning to get a second dose. That number is over 99%. So it's one of the reasons why we're pretty sure that we will hit our 4 million people in Massachusetts vaccinated goal by the beginning of June. The vaccination progress is one reason why we've been successful at reducing the spread of COVID. Thanks to the improvements in our public health metrics, we've been able to move forward on some of our phased reopenings. And effective today, as many people know, we are moving into phase 4, step 2, which means road races and other large outdoor organized athletic events are permitted to take place if appropriate safety measures are followed. Large capacity venues like stadiums and arenas and ballparks can increase their capacity to 25%. And over the past few months, we've been doing everything we can to ramp up vaccinations to support the continued safe reopening of the Commonwealth. This latest progress is obviously good news for all of our businesses, for our workforce, and for our communities. The progress on reopening the Commonwealth would not be possible if Massachusetts wasn't so successful at getting people vaccinated. I can't stress enough that these vaccines have proven their mettle here in the Commonwealth. They are safe, they are effective, and they are keeping people healthy out of the hospital time and time again, and it shows in our data, not just here in Massachusetts, but across the country and around the world. And it's community health centers like this one here at Manat that have been at the center of a big piece of that effort. Our community health centers have now administered over 500,000 doses of COVID-19 vaccine to their patients and community members since the rollout began. And as we move forward, we expect community health centers to continue to play an even more important role in reaching some of the hard-to-reach populations. A week ago, we announced that our efforts would shift on vaccine strategy to focus on more targeted community-based outreach, and we're working with healthcare providers, health systems, local boards of health, and community health centers like this one to build a significant vaccine distribution infrastructure that will be able to effectively reach out to, connect with, and vaccinate tens of thousands of residents each day, many of whom would have difficulty pursuing vaccines under the more traditional approach. But once you get to the point where almost 3/4 of your population has been first dosed, you need to start pursuing, as we are with our partners, additional strategies to get to that last 25%. We still have a lot of work to do to reach the folks who haven't gotten vaccinated yet, some of whom are obviously part of the wait-and-see community or are still considering it. But our goal is to reduce as many barriers as we possibly can to provide access and information and hope that they will join us in getting vaccinated here in the Commonwealth.